Hey there. You asked for a deep dive on recurrent depression, so you get right to it. We've got some fascinating material to unpack today. A whole psychiatry textbook, in fact, that focuses on this topic with chapters on how widespread it is, how it plays out, like across a whole lifetime, and even some groundbreaking new treatments, things that are really pushing the boundaries.
And what's so valuable about these sources is that they don't just tell us what recurrent depression IIS, but, they dig into why it's so hard to manage, how it impacts the brain over time. But most importantly, what we're going to be focusing on is what you can actually do about it, which is what, I think is what you're really here for.
Absolutely. So consider us your guides. I'll be, kind of highlighting those interesting points, maybe some surprising stats, and then we're going to hear from our expert who can really connect the dots and explain why it all matters in the grand scheme of things.
Let's dive in.
The scale of this problem really struck me. Like, depression isn't rare, it's not unusual, it affects over 18 million people in the U.S. at any given time. So to put that in perspective, imagine a city the size of, I don't know, Chicago, where everyone is dealing with depression. That's how many people are affected right now.
And what makes it even more complex is that for most people, it's not a one-time thing. It comes back, often even more severe and harder to treat each time. So it's not, just feeling down for a little while. It's a pattern, and it can really shape, someone's whole life, especially if it starts early.
That early onset, it was really something that stood out to me in these sources. We're talking adolescence, sometimes even younger. Imagine the impact of depression during those critical years, your teenage years. You know, relationships, school, education, it's a lot.
And that's why early diagnosis and treatment are just so crucial. And unfortunately, we still see underdiagnosis, under treatment, especially with younger people. And, those are missed opportunities for early intervention that, can have consequences for years to come.
Yeah, there's a chilling stat in here that I just couldn't shake. Teen suicide rates in the U.S. have quadrupled in recent decades. It's heartbreaking, and it just really underscores how high the stakes are when we're talking about depression, especially in young people.
And that's where I think the economic and social impacts really come into play. We think of depression as this individual struggle, but the sources make it clear it affects all of us. It's not just, the healthcare costs, which are real, but lost productivity, missed work days, even disability.
We kind of forget that mental health, IS health, right?
Yeah.
Like we readily accept that, okay, a physical illness has real world costs, but we don't always extend that same understanding to mental health.
Absolutely. And, the sources highlight that depression is more than just feeling sad, right? With these repeated episodes, there are actual physical changes happening in the brain. We're talking about a measurable degeneration of brain tissue, and that helps explain why treatment can become more difficult over time.
It really drives home the fact that this is a real illness. It's not just willpower, it's not attitude. And this makes the case for early intervention even stronger, right? Because if we can prevent those recurrent episodes, we might also be able to, like, stop some of those brain changes from happening.
That's a crucial point because it's not just about managing those symptoms. It's about long-term brain health. And then, these sources really emphasize that women face unique challenges when it comes to recurrent depression.
There's a whole chapter dedicated to the female experience, and it's not about stereotypes. It's about biology. The hormonal fluctuations women experience throughout their lives, especially during puberty, pregnancy, menopause, has a huge impact on mood.
And they really break down the specifics, like, explaining how those shifts can trigger or worsen depression. It's not just about low estrogen, for instance. It's the changes, the rapid changes in estrogen levels that seem to be really problematic.
One thing that surprised me was that while menopause itself isn't directly linked to higher depression rates, that transition, the perimenopause, is a time of increased risk.
Yeah.
Most people think it's menopause itself, but it's actually, those years leading up to it.
And think about what that means for women.
Right.
Perimenopause often coincides with all these major life changes, kids leaving, aging parents, maybe career changes. So it's a lot to deal with. And if you're already, prone to mood swings because of these hormonal changes, it's a perfect storm.
So for anyone listening, if you are a woman going through any of these life stages or you have loved ones who are, pay attention. Mood changes, seeking support, it's crucial. Early intervention, we can't say it enough, is so important in preventing a more severe, chronic course of depression.
Absolutely. And it's not just about ourselves, right? It's about friends, family members, colleagues, anyone we care about. Sometimes just asking, are you okay, can be that first step in helping someone get the support they need.
We've talked a lot about the challenges of this recurrent depression, But these sources don't just leave us hanging. They really focus on solutions. And there's this argument for a big shift in how we think about treating this. It's not just about, like, treating the episodes, but preventing them.
They actually compare it to managing any other chronic illness like diabetes or heart disease. It's about thinking long term,
Mm.
making those lifestyle changes, having an ongoing management plan so you stay well.
It's a really helpful way to reframe it. It's like you don't expect to cure diabetes, you manage it.
Yeah.
And maybe that's a more realistic and empowering way to approach this, too.
Exactly, because it's about accepting that there might be ongoing challenges, but there are also tools, there are strategies to navigate those challenges and live, a meaningful life.
So what does that actually look like, practically?
Hmm.
The sources lay out some key strategies. First up, early detection and treatment. We've talked about how crucial that is, especially, family history, early warning signs.
Then you have things like genetic testing. It's still relatively new, but it has the potential to, really personalize those treatments. Identify your vulnerabilities. We're not quite there yet, but it's an area to watch.
Another strategy is more widespread screening,
Hmm.
especially high-risk groups. So that could be women, people with certain medical conditions, folks who have experienced trauma, people facing those major life transitions.
And it's not just about the screening. It's about making sure that screening leads to, action,
Mhm.
making mental health care accessible, getting rid of the stigma so that people feel comfortable asking for help.
One of the most effective approaches, according to these sources, is what they call combination treatment. And basically, that's using both medication, AAD therapy, so kind of tackling the problem from multiple angles.
Absolutely. You know, for a lot of people, medication can be a really valuable tool to manage those biological aspects of depression, while therapy provides, that space to really explore those emotional, psychological, interpersonal things that are contributing to the illness. So it's about addressing the whole person, not just, just the symptoms.
And it's important to find the right medication and the right dosage, right? Because the book talks about, it's not one size fits all. Sometimes it takes a little bit of trial and error.
Yeah, it's a process. And it's a process that requires communication, right?
Yeah.
Talking to your doctor, What are you concerned about? What are your preferences? Be honest about those symptoms, your history with depression, any previous treatments you've tried. The more information you give your doctor, the better they can, help create that plan for you.
And it's such a good reminder that you are ultimately in charge of your own healthcare journey.
And you don't have to go it alone, right? Family, friends, that can make a huge difference. They can spot those early warning signs. They can offer support. It's a big change from, the old days where mental health was very isolating.
The sources also talk about all these new treatments that are like pushing the boundaries of what's possible. So things like TMS, VNS, even DBS, they're offering hope for people who haven't found relief with traditional approaches.
It's really an exciting time for mental health treatment. We're moving beyond the limits of the past. And these are exciting, but, they're still being researched, they're still being refined. But, for people who have struggled for years, these new options, they might offer a chance to get their lives back.
So we ended last time talking about these really cutting-edge treatments like TMS, VNS, and DBS. And, they sound pretty futuristic, so I want to kind of unpack those a bit more. Like for someone who's tried those, traditional antidepressants, hasn't had much success, what kind of hope do these treatments actually offer?
Well, they're definitely not a quick fix, but they do represent a whole new avenue, for treatment-resistant depression. So, for example, TMS, which stands for transcranial magnetic stimulation, it uses magnetic pulses to stimulate certain brain regions, the ones involved in mood regulation.
So it's almost like jump-starting those circuits that might be underactive.
Yeah, that's a great way to think about it.
And is this, like, does it involve surgery?
No surgery. You just sit in a chair and they position this device over your head and the pulses, they pass right through your skull, targeting the specific area. And it's been shown to be really helpful, especially for folks who, haven't responded to traditional medications.
So it could be a game changer for those people who feel like they've, kind of hit a wall with medication.
Mm.
What about VNS? So we talked about this implanted device, which, might sound a little intimidating for some people. Is there a way to, explain that in a way that feels a little less sci-fi?
Sure. So VNS stands for vagus nerve stimulation. And it involves a small device, almost like a pacemaker, that gets implanted under the skin in your chest. And it sends like these mild electrical impulses to the vagus nerve. And that nerve runs all the way from your brain down to your abdomen.
Wow, so it's sending these signals through this, like, super highway of a nerve. But how does that actually help, someone with depression?
Well, that's where it gets really interesting because the vagus nerve plays a big role in all sorts of things: mood, stress response, even inflammation, which, we now know is linked to depression. So by stimulating it, we can actually influence those key areas of the brain that are involved in mood disorders.
It's amazing how we're learning to kind of tap into the body's own systems to promote healing, right? Yeah. Now, DBS, deep brain stimulation, this one sounds like straight out of movie.
It does, and it is a more invasive procedure than, TMS or VNS. It involves implanting electrodes into very specific regions of the brain. And those electrodes are connected to this device that's implanted in the chest, and that sends these continuous electrical signals to those brain circuits.
So it's like having a little brain pacemaker, constantly fine-tuning things. But if it's so invasive, who is it really meant for?
Well, DBS is usually reserved for, folks with severe treatment-resistant depression, people who haven't found relief from, anything else. So it's a big decision, and it's not without risks. So it's only considered after a thorough evaluation and, discussions with a whole team of specialists.
These new treatments offer a lot of hope, but, the sources we're looking at, they also say it's not just about these high-tech solutions, right? They talk about a holistic approach to managing this recurrent depression.
That's right. They really emphasize that depression isn't just, some brain chemical imbalance. It's this complex mix of, biology, psychology, social factors, even environmental things. So effective management means addressing, all those aspects.
So it's not just about finding the right medication or the right therapy. It's about lifestyle changes, right? It's about building support. It's about understanding your own personal triggers.
Exactly. And they talk about things like, sleep hygiene, stress management techniques, exercise, even nutrition. It's really about taking care of your whole self, mind, body, spirit.
And I really appreciate that they bring in the role of loved ones because it's not something you have to do alone. Having people who understand, who can see those warning signs, offer support, it makes a difference.
Social connection, it's so fundamental, right? And it's even more important when you're dealing with mental health challenges. Isolation, it can really worsen depression, but, those strong relationships, they can help buffer you against the stress and relapse.
They make this really interesting point, thinking about depression like any other chronic illness, like diabetes or heart disease.
Yeah, and that's such a shift in thinking, right? Because it helps to destigmatize it, to see it as a medical condition, not some personal weakness. And it's about taking that proactive approach, taking medication as prescribed, going to therapy, monitoring your moods, being aware of those early warning signs.
So speaking of those early warning signs, what are some things people should be looking for? Because I know it's different for everyone, but are there any common red flags?
Absolutely. Well, some common signs to look out for are changes in sleep patterns, either too much or too little. Changes in appetite, fatigue, difficulty concentrating, loss of interest in things that used to be fun, and, feelings of hopelessness or worthlessness. And I think it's important to remember these signs. They can be subtle. They might not always, scream depression, but it's about paying attention, noticing those shifts.
It's about knowing your own baseline, right? Like what's normal for me and what feels different. And what happens if you do notice those signs? Do you just wait and hope it passes?
No, the key is to take action. Don't ignore those signs, hoping they'll just go away. Reach out. Your doctor, therapist, a friend, family member, let them know you're struggling, that you need some support. And, don't be afraid to adjust that treatment plan if necessary. And really make sure you're prioritizing those self-care practices that help you feel grounded.
It's about empowering yourself, taking charge of your mental health, not just being passive. And that kind of leads to another thing these sources talk about, navigating the mental health care system. If you're just starting out, it can be really overwhelming.
It absolutely can. I mean, there are so many different types of providers, different treatment options, insurance plans. It's a lot, and it can feel bureaucratic and confusing, especially when, you're already struggling.
So where do you even begin? Well, they actually offer some really great advice on becoming your own advocate in this system.
Well, I think the first step is information. Learn about your condition, learn about the treatments, learn about your rights as a patient. Because knowledge is power, especially when it comes to your health. And there are a lot of good resources out there, like NAMI, the National Alliance on Mental Illness, and DBSA, the Depression, and Bipolar Support Alliance. They have really reliable information and support.
So once you've done your research, you kind of have a better sense of the landscape. What's next?
Don't be afraid to ask questions. Lots of them. Talk to your doctor about your concerns, your preferences, what you're hoping to get out of treatment. Be honest about those symptoms, your history, any previous treatments. The more they know, the better they can help you.
And what if you're not getting the answers or the care that you need? They talk about being persistent, and I think that's so important because it's easy to feel dismissed, like you're not being heard, especially with mental health.
You absolutely have a right to advocate for yourself. If you're not feeling heard, if your concerns aren't being addressed, get a second opinion. You can also reach out to those patient advocacy groups or explore those online resources for more support and guidance. Remember, your mental health is worth fighting for. You deserve compassionate, effective care.
It's inspiring to hear you talk about that empowerment, self-advocacy. It can be hard to feel that when you're struggling, but you are the expert on your own experience. You have the right to demand that care.
And never underestimate the power of connecting with others who understand. Support groups, online forums, those community organizations, they can offer a sense of belonging, shared wisdom. You're not alone in this.
That actually leads to something else these sources bring up, the impact of stress on this recurrent depression. I mean, we all experience stress, but for someone with a history of depression, it could be a huge trigger for a relapse. And they talk about this fascinating connection between stress, genetics, and, how depression develops.
Yeah, it's not like, stress causes depression, but it definitely plays a role. And we know that people with a genetic predisposition to depression are more vulnerable to those effects of stress. So it's like you have this vulnerability that gets kind of activated when you're exposed to certain stressors.
So it's not about like avoiding stress altogether, which is probably impossible, but it's more about, how does stress affect me personally?
Yeah.
What are my healthy coping mechanisms?
Exactly. And they talk about, the specific types of stressors that can be really problematic for people with depression, things like, major life changes, trauma, that chronic stress, even social isolation. They can all increase that risk of relapse. But it's not just that the stress is there, it's how we perceive it, how we cope with it.
And that's where therapy can be so helpful, right? Because it
It is
can give you
that.
those tools to navigate those stressful situations more effectively and, build that resilience.
Absolutely. Therapy can help you, figure out what are my stressors? How can I cope? How can I challenge those negative thoughts? How can I feel more in control? It's really empowering.
And they also talk about building that support system, right?
Right.
Those people you can turn to when those stressful things happen. Because, that can make all the difference in managing stress and, preventing those depressive episodes from coming back.
It's true. That social connection is such a buffer. When we feel loved, supported, understood, we're better equipped to deal with life's challenges. And on the flip side, isolation can actually worsen depression and make it harder to cope. So it's about reaching out, building those connections, letting yourself be vulnerable. And, if you're struggling to build those connections, therapy can be a great place to start. A therapist can help you with those social skills, overcome any anxiety, and really start building that network.
It's a reminder that we don't have to do this alone. And speaking of therapy, the sources talk about a few specific types that have been particularly helpful for people with recurrent depression. One is CBT, cognitive behavioral therapy. Can you give us a quick rundown of that?
Sure, CBT really focuses on the connection between thoughts, feelings, and behaviors. The idea that our thoughts influence how we feel, and how we feel influences how we act. So in CBT, you work with a therapist to identify and challenge those negative or distorted thought patterns that are contributing to the depression. So you learn to, replace those unhelpful thoughts with more realistic, more balanced ones. And you develop these coping mechanisms for managing those difficult emotions.
So it's almost like retraining your brain, to think in a more positive and helpful way, and then using those thoughts to guide your actions. It sounds very like practical, action-oriented. They also mention interpersonal therapy, IPT. How is that different?
Well, while CBT focuses on that interplay between thoughts, feelings, and behaviors, IPT focuses on relationships. How do those relationships play a role in your depression? So it helps you identify and address those interpersonal issues that might be contributing, like conflicts, grief, transitions, social isolation. So it's about strengthening communication, setting those healthy boundaries, building, more fulfilling, supportive relationships.
Recognizing that our relationships really do impact our mental health. And sometimes those relationships need a little work, especially when we're dealing with depression. And it sounds like from these sources, there's no one-size-fits-all approach to therapy.
Exactly. It's about finding what works for you, what feels right for your personality, your needs. And just as importantly, finding a therapist that you click with, someone you trust, someone you feel understands you. That relationship is so key to the success of therapy.
It's like any relationship. It has to feel right. That
Yep.
connection, that trust, that understanding. And I think that's a good reminder for any healthcare relationship, right? Whether it's your therapist, your doctor, whoever it is, you have a right to find someone you feel comfortable with, who's listening to you, who's taking your concerns seriously. These sources do a great job of highlighting that mind-body connection when it comes to depression. It's not just a mental illness. It affects your whole body.
That's so important. Depression doesn't just stay in our heads, right? It shows up in our bodies. People with depression often experience fatigue, sleep problems, changes in appetite, digestive issues, aches and pains, even a weakened immune system. And it goes both ways. Those physical health problems can also contribute to depression.
So it really is this dance between mind and body,
Yeah.
where each one impacts the other. So it makes sense that treatment should be holistic, right?
Mm.
Addressing those physical things along with those mental health symptoms.
Absolutely. It's about seeing the whole person, not just the diagnosis. So that might mean seeing a doctor for medical evaluation, making those lifestyle changes to improve sleep, diet, exercise, managing chronic pain. It's all connected.
And they offer a lot of really practical advice, about those lifestyle changes. Getting exercise, eating a balanced diet, stress reduction techniques, making sure you're getting enough sleep. It can make a huge difference for both, physical and mental health.
And, it's not about being perfect. You don't have to make these drastic changes overnight. It's about starting small. Maybe you take a 10-minute walk each day, add some veggies to your meals, do some deep breathing before bed. It's about building those healthy habits and celebrating those little wins. And, one thing that people often forget is sunlight. Getting enough sunlight can really boost your mood, regulate that sleep-wake cycle, increase your vitamin D. So try to get outside each day, even if it's just for a few minutes. And they also talk about doing things that bring you joy, things that give you a sense of purpose. Maybe that's spending time with loved ones, pursuing hobbies, volunteering, connecting with nature. It's about finding those things that light you up.
It's about reclaiming those parts of yourself that maybe got lost, in the fog of depression. Remembering who you are, what you love, what makes you feel alive. And then make a good point. Self-care isn't selfish, it's essential. It allows you to show up as your best self for yourself and for those around you.
It's like that saying, put your own oxygen mask on first before helping others.
Exactly. You can't pour from an empty cup. Now, one of the biggest challenges with recurrent depression is, dealing with that emotional roller coaster. And they acknowledge it's difficult, but it's important.
It's okay to feel those emotions. Sadness, anger, frustration, hopelessness. It's all valid. It's part of being human. The important thing is, how do we respond to those emotions? How do we manage them in a healthy way?
And they talk about, developing healthy coping mechanisms for dealing with those intense emotions rather than letting them overwhelm you or lead to those unhealthy behaviors.
So that might be, talking to a therapist, journaling, practicing mindfulness, doing something creative, connecting with supportive friends and family. And sometimes it's just giving yourself permission to feel those emotions, without judging yourself, to grieve, to cry, to express yourself.
To create space for those emotions,
Yes.
right? Acknowledging them, but not letting them define you. And remembering that, they won't last forever. They're like waves, they ebb and flow. And as you build those skills, as you become more resilient, you'll find that you can navigate those waves and come out stronger.
It's like building a muscle. The more we practice those healthy coping skills, the stronger we get at handling those tough emotions. And, don't forget, there's hope for recovery. Even when it feels challenging, there's always a reason to believe that things can get better.
Now let's talk about medication, because I think that's a big source of anxiety for people with depression. Should I, shouldn't I? And these sources really present a nuanced view on that, acknowledging the benefits and the limitations.
Mm.
So what would you say to someone who's hesitant to try medication, Maybe they've had a bad experience in the past.
I understand the hesitancy. There's a lot of stigma, a lot of misinformation about medication. But it's important to remember it can be a really powerful tool, especially for people with moderate to severe depression or those who haven't found relief through other methods. And, antidepressants, the way they work is by targeting those brain chemicals, the neurotransmitters that regulate mood, sleep, all sorts of functions.
And there are so many different types of antidepressants, and each one works a little differently and has its own side effects.
Exactly. It's not a one-size-fits-all thing. So that's why it's so important to work with your doctor, to find the right medication and the right dose for you. And it can take some time, some trial and error to get it right. And it's important to have realistic expectations, right?
Hmm.
It's not a magic cure. It's a tool that can help manage those symptoms, improve your mood, and make it easier to engage in those other therapies and, those lifestyle changes.
Because they really stress that, medication isn't a cure for depression. It's part of a bigger plan.
It's about using everything we've got, all those tools, to build a better life. And of course, side effects, right? That's a big concern. Some common ones are nausea, headaches, insomnia, weight gain, and sexual problems. So if you're having side effects, talk to your doctor. There might be a different medication or there might be ways to manage those side effects.
It's about communication, right?
Yeah.
Being honest with your doctor, being your own advocate. And, these sources really get into the anxieties that a lot of people have about the future when they're dealing with recurrent depression. It's natural to worry, what if it happens again?
It's understandable to feel that way, but the message is that there's always hope. With the right treatment, the right support, self-care, you can break free from those cycles and build a life that feels good, a life that feels meaningful.
So it's not about like predicting the future or guaranteeing that you'll never have another episode, but it's about giving yourself those tools and those resources so you can handle it if it does happen.
Exactly. Recovery is a journey. It's not like this finish line you cross. There will be bumps in the road, but you learn, you adapt, you find what works for you. And, they actually encourage people to kind of shift how they see relapse. Instead of seeing it as this failure, see it as an opportunity.
That's interesting. Like instead of beating yourself up, you're learning from it.
Exactly. Each relapse can teach you something,
Right.
right? About your triggers, your coping skills. Maybe your treatment plan needs adjusting. It's a chance to fine-tune things, get stronger. So don't see it as the sign that you're broken or hopeless.
That's a really powerful way to reframe it. Like it's data,
Yeah.
it's information. It's a chance to grow.
And remember, you're not alone. A lot of people with recurrent depression experience this. It's part of it for a lot of folks. But it doesn't have to define you. It doesn't have to control your life. And the book gives a lot of great advice on, what to do if you're going through a relapse. It talks about reaching out for support, reassessing your treatment plan, and really understanding those triggers that might be setting you off. So it's really about taking that active role in managing your mental health. And they emphasize that recovery is not a linear process. There will be setbacks, there will be challenges, but there will also be breakthroughs, moments of joy, and a growing sense of resilience.
It's about celebrating those victories, no matter how small, and remembering that you are stronger than you think.
It's about focusing on progress, not perfection, and knowing that you have the power within you to create a life that feels meaningful and fulfilling, even with the challenges of recurrent depression. We've covered so much ground in this deep dive, from the biological underpinnings of depression to the latest cutting-edge treatments, from the power of self-care and support systems to the importance of challenging stigma and advocating for your own mental health needs.
And through it all, we've kind of woven in these stories, experiences, and wisdom from these incredible sources, offering this really multifaceted perspective on this complex and often misunderstood illness.
It really is.
As we wrap up this episode, we wanted to leave you with a sense of empowerment and hope. What resonated most with you from our exploration of this material? What questions or insights emerged that feel particularly relevant to your own experience?
Take those questions, those sparks of curiosity, and use them as a starting point for your own journey. Connect with resources, reach out for support, and continue learning and growing on your path towards healing.
And remember, even amidst the challenges of recurrent depression, there is always reason to believe that things can and do get better. Keep believing, keep fighting, and never give up on yourself.